everybody, Dr. Luke Stringer here, Advanced Health Chiropractic, and I'll spend a moment with you discussing how chiropractic care can help women across the board, from painful irregular menses to going through gestation to pre-postnatal care. Let's focus on a common complaint that we see. It's the number one cause of disability in America. It's low back pain. Well, obviously low back pain is going to involve the nerves in the lower back. However, we have two types of nerves. We have sensory and asensory. So if you compress the sensory portion of the nerve, you're going to get pain. However, only 15% of your nervous system has the ability to emit pain signals. 85% of your nervous system doesn't have the ability to emit pain, so we typically get dysfunction within an organ system, for example. So typically, these nerves in the lower portion of your lower back, they're going to innervate reproductive tissue. So when our female patients come in, they're obviously coming in for the typical low back pain, pelvic pain. However, when we do a deep dive through our consult and our history and our exam, we find typically that we can have painful irregular menses too. This is coming from subluxation joints that shift and compress nerves. If nerves compress, we can get pain and or get dysfunction. So a common symptom that we're treating and helping our lady patients with, or our female patients with, are painful irregular menses. So I'm going to show you an adjustment that can help improve both low back pain function, and essentially a subsidiary of that is going to be improving function of the reproductive tissue, which is going to help with painful irregular menses. So here we go. All right, guys. So whenever you're evaluating low back pelvis unit, lumbopelvic spine, we want to evaluate leg length. And if we have an inequality in leg length, we always want to evaluate pelvis. So Dr. Leahy's leg length on the right is shorter than his leg length on the left, and then this right hip is shifted. Typically when the hip shifts, it can create rotation in the lower back. So obviously when we're evaluating Dr. Leahy's lower back, he's rotated left to right, feel tissue tonicity. So obviously that can create low back pain, but as we just discussed, those nerves don't all emit pain. We can get dysfunction. So in our female patient can manifest as painful irregular menses. In males, it can be erectile dysfunction as we age, for example. So this is an adjustment that we're going to do for Dr. Leahy's low back and pelvis. So we're going to stabilize here. We're going to use the drop piece. Good. Dr. Leahy's going to lay in his left side for me. So obviously we know as chiropractic physicians, these lower lumbar nerves innervate reproductive tissue, so we're going to find that fixed joint. We're at L4. We're going to contact spine, rotate. Nice job. All right, thanks. All right, guys, so if you're watching the video on YouTube, please subscribe and turn on the notification bell. If it's Instagram or Facebook, follow the page. If you're watching this video and you have low back pain, painful irregular menses, this is something we can help you with without the use of drugs and surgery. Just hit the link in this video, take you to our website, our new patient booking form. Hopefully you enjoyed that one, and we'll see you back on the channel with some awesome content soon.